A 70-year-old male has a precancerous lesion on his right tongue. Check out the treatment today on the open reduction. Welcome to the Open Reduction, your channel covering all topics oral and maxillofacial surgery. I'm Dr. Tom Bolten, and today we're treating dysplasia of the right tongue. This patient is a 70-year-old male who was recently referred to my office for a suspicious lesion on his right tongue. On exam, he has several areas of leukoplakic changes. These lesions may represent hyperkeratosis, but there is concern for either a cancerous or a precancerous lesion. This certainly warrants a biopsy, which I performed in the office. The pathology report came back as moderate dysplasia. Dysplasia is a precancerous lesion, where the epithelial cells display irregular size, shape, and organization. There is a high likelihood that this will become oral cancer, so we need to treat this aggressively. There are several methods to treat dysplasia, and for this patient I plan to use cauterization. The suggested minimal margin is 3 millimeters, but I like to err on the side of caution, so I go usually about 5 millimeters. This means I will cauterize all leukoplakic tissue along with 5 millimeter margins to minimize the risk of recurrence. This procedure is done in the office under local anesthesia. Once the patient is thoroughly numb, I use the cautery tip to ablate all epithelial tissue. I cauterize all suspicious tissue. This is obviously painful during the recovery period, so I only want to cauterize the areas of concern. However, I can't be too conservative because if I leave anything behind, we'll have to do this again. Obviously, the patient does not want that. The tongue is a muscle with a very rich blood supply, so if I go too deep, I will encounter significant bleeding, which can be hard to control. I want to carry the ablation to the depth of the muscle, but not into the muscle. Here we can see the cautery tip encountered a small vessel. My assistant clears the area with gauze, which allows me to locate the bleeding vessel and cauterize it. This stops the bleeding. I cauterize all areas of concern and monitor to make sure there's no signs of bleeding. Cautery works by removing all epithelial cells to the basement membrane, which allows new healthy cells to grow in its place. In some cases, this is successful after a single cautery treatment. Other cases require several rounds of cauterization to eliminate the dysplasia. Some dysplasia cases are refractory to cauterization and require different treatment modalities. I will see this patient back after 6 weeks to reevaluate, and then he'll be on a recall protocol to monitor for additional signs of dysplasia. If any lesions return, I will treat with another round of cautery. Thanks so much for watching. Please click those like and subscribe buttons and check out my website, theopenreduction.com, for your continuing education needs. I'm Dr. Tom Bolten. I'll catch you next time on The Open Reduction.